Valentine, and today what we're discussing is a non-surgical spinal decompression. You might have heard of it. It's a very popular procedure for those people that have bulging discs, herniated discs, a condition called spondylolisthesis. It's good for people that have arthritis in their spines, and of course it could be utilized on people that have prolapse or protruding discs, slip discs, those type of things. This is the decompression table right here. We chose this spinal decompression table because there is multiple tables. This is called the DTS, and this table allows us to, of course, do certain things like raise the legs upwards, which makes it more comfortable, and then the individual will have their feet or heels on here, which relaxes the lower back, making the decompression that much more effective in the lower back area. These are harnesses. This one's going to go around the waist, and this one is going to go just above the waist area, and all kind of overlapping, so that we can concentrate and focus on that particular level, because you have 5 levels in the low back: L1, L2, L2, L3, L3, L4, L4, L5, and L5, S1. Many times the disc that's a major problem is the very last one, L5, S1, and about 95% of all lower back problems, that's where the problem is showing up, the compression on that nerve, which will relate into what we call sciatic pain. You might have heard of that. And of course, this is fantastic for helping those individuals that have suffered with chronic sciatic type pain. Now, this type of procedure, the spinal decompression, is able to use on someone in their early 20s. We even have someone late teens, because they actually fractured their vertebra in their lower back, and we were able to help them avoid back surgery with part of the spinal decompression, as well as specific strengthening exercises for them. We do things a little different in our office, and the thing that makes us unique is that not only do we use the spinal decompression, but we utilize what is called the electrical muscle stim. This is not a TENS unit. It is different than a TENS unit. It's designed to help relax the muscles, so that as we're opening up your spine, because this table will separate, we're able to relax those muscles, which allows the effectiveness of the spinal decompression to be that much greater. Also, the table has a vibration unit attached to it. What research has shown is that vibration helps stimulate an area of our brain called the cerebellum. The cerebellum controls our posture, our balance, how we are relating into space. It also controls our postural muscles, those spinal muscles, those muscles on both the right and left side of the spine. So by doing the vibration, it stimulates the cerebellum, and then the cerebellum then communicates to those muscles, and of course allows those muscles to relax, which then allows the spinal decompression table to be that much more effective. Another thing, the third thing that makes this very unique, besides the muscle stim, the whole body vibration, is oxygen concentrators. Oxygen concentrators mean that they're pulling oxygen out of the air. They're concentrating it anywhere between 94 to 97% pure. This is not a tank. Of course, the oxygen tanks that you see people using, that's 100% pure oxygen. By doing that, we're now adding another aspect as far as oxygen therapy, which again is stimulating the cerebellum. So not only does vibration help stimulate the cerebellum, but so does oxygen therapy. There's a great book. It's called Stop or Slow the Aging Process. It's written by William Douglas, MD, and he talks about the many advantages of oxygen therapy. The big thing about oxygen therapy is that for every year above the age of 20, our body's ability to assimilate oxygen decreases by 1%. So let's say that you're 40 years of age, you're 20 years above the age of 20, which means that you've lost 20% of your body's ability to utilize oxygen. That becomes real critical, and as we go through this aging process. You're talking about someone 70 years of age, and now they've lost 50% of their body's ability to utilize oxygen. So many patients that we see and utilize the spinal decompression therapy with, they are older as well as younger, but the older patients really enjoy this. Many of our patients actually fall asleep during the sessions, and the sessions last for about a little over 20 minutes. If you see right here, also the front part of the table can be brought up. Now that's real important because some people, you know, they have a rounded out posture and they have a hard time laying flat. That's what also makes this table very unique. Not too many tables can go into that position. Also, this table allows us to also put people on their stomachs. We would just move these, which are bolsters that go behind the knees, and we would place the patient on their stomach with their face down. Of course, there is not only the pillow, but there is an opening here for them to breathe. So this allows us to take care of those individuals that have maybe fractured their lower back, especially those individuals that have a spondylolisthesis, or they've had so much wear and tear in the lower backs over years of chronic problems that they kind of never addressed, that they develop what we call a forward displacement or an anterior listhesis of the vertebra, or of several vertebrae, which is very unstable. Those individuals now start to get a condition called spinal stenosis. So not only is it able to help people that have spondylolisthesis, it's also able to help people that have spondylolysis, which is arthritic changes in the spine, spinal stenosis, bulging disc, herniated disc, as well as sciatic type pain. So basically that's it. That's what I want to discuss with you. This table also allows one more final thing that I almost forgot about. But this does allow us to do cervical as well. So we have many people that have cervical arthritis, again, bulging discs in their neck, people that have what we call radicular pain that might radiate down their arm and into their hand, and that becomes so severe that now they are losing the strength of the grip in their arms and hands and their strength, and now they need something that is a little bit more advanced than typical traction therapy, and that's where the spinal decompression comes in. This is a computer here which allows us to ramp it up, and it goes through frequency. So it goes through a process of opening gradually and then closing gradually, and a frequency that you can barely feel. And the thing that this does allow, spinal decompression, is to not have the muscles go into a contracted or spasm state. Many people that have had traction therapy before in the past, they noticed that they might have had traction therapy that felt great while they were doing it, but then they couldn't get up and walk. In this particular case, we don't have that happening. Also, what makes us unique is we're going to start people at a lower weight than most offices will do, and the reason being is because not everyone's the same. You got to take in the factors of age as well as your spinal condition, and that's why we always have X-rays or we have MRI reports to go ahead and look at and to justify what we're doing. So thank you for this short time that I've had with you on spinal decompression.